This is Dr. David Klein with Stages of Life Medical Institute. Thank you for tuning in. Appreciate your watching, listening. Hopefully we'll be able to teach you something or share something with you. We're going to do a short series of these on statistics. And you're going to think, well, gee, how boring could that possibly be? I took enough statistics when I was in college. I got sick of it then. I'm sick of it now. What's interesting about statistics is it's a lot like arithmetic and mathematics. Sometimes the more you learn, the more relevant it becomes. I took half a dozen statistics courses, undergraduate, graduate, and postdoctoral, and every time I took a course, I learned something even more interesting and how to apply it, and things make more sense of it. So we're not going to get into some of the more arcane things, which might be standard error of the estimate. Why? That's actually where these folks are pulling these numbers out, looking at what the anticipated deaths might be. It's not just a matter of looking at a graph and going, oh, gee, this is the way these things work. It's actually mathematical models that make a great deal of sense based upon similar graphs that we saw in the past. However, your statistics are only as good as your raw numbers. So as a physician, I've been doing this over 40 years. I've been called upon to fill out these odd sheets that happen when people pass away. They're called death certificates. And there I sit, with a hat on and a mask and a whatever, and I get to decide forevermore what this patient died from. Think about that as a responsibility. What did this patient die from? Well, ultimately, each and every person that passes away dies because their heart stops. So they say on there, please don't put that as the cause of death because it's rather obvious. The heart stopped, they die. What killed the patient and what did the patient die of and what are the mitigating factors? That takes a lot of judgment, it takes a lot of time, and nobody likes filling these things out. So when I was in my training, it usually fell to the intern to fill these out because the attendings, the private practice docs or the professors, they didn't want to waste their time. Then it went down to the senior residents, then the junior residents, and ultimately it dropped down to the people lowest on the totem pole, those individuals with the least training, the least education, and really the least amount of time if you really want to know the truth. So you blew your way through these things. So what was the cause of death? We're in the middle of a pandemic, which is an epidemic that goes internationally, So we're in the middle of a pandemic, and they are stacking up bodies in China, which actually look like ashes to me, in little bottles, They can't they can't dispose of these ashes fast enough, and yet they have fewer deaths than they do in New York State. I don't think that makes any sense. They lie on their statistics, the Chinese, straight up front. They look at you in the eye, they talk through the World Health Organization, who, by the way, I wouldn't be paying a lot of attention to if I were you, because they parrot the Chinese position. Makes everybody look bad. So when we listened to what they had to say about this virus with an ear, like maybe they know what they're talking about, we missed the idea entirely. We blew it. We lost 2 months worth of time where we could have prepared for this better. So don't listen to the Chinese. Don't buy their stuff anymore. Buy American. That's just, I spent a lot of time, a lot of training in Texas. We used to have this phrase down there, at least the Texans have since the 1850s. It's called remember the Alamo. We need to remember the Chinese, Look around you. A third of the population is going to be out of work here shortly. The economy is going into a tailspin. Remember the Alamo. Remember the Chinese. So what is it about these statistics that lies? Well, because somebody ends up with an infection and multiple chronic illnesses, what is it that killed the patient? Was it the chemotherapy that trashed their immune system? Leukemics can't catch infections without getting very, very sick. They catch a common cold, they die. So was the virus the ultimate cause of death? Was it the fact that they had diabetes out of control, that morbid obesity and chronic obstructive pulmonary disease? What was it that killed the patient? So what you need to understand is relative risks. 25% of people that catch COVID are asymptomatic. That's the reason why social distancing works. Why? Because you can look at somebody and you can't tell, A, whether they're sick, they've been exposed, or whether they're currently throwing the virus off. So the social distancing thing is extraordinarily important because it's not just true of COVID. It's true of many illnesses, to include things like tuberculosis, It could be influenza, it could be lots of things, rhinovirus. People get sick and not even know it. If you've got a good, healthy immune system, and most people do, then you're never going to know you got sick. How can you tell the difference between allergies and COVID? It's not so easy to do. Now, somebody may say, well, you can try antihistamines, and if that helps, well, then you might be right. It's 50%. So the deal here is take these statistics with a grain of salt. In this country, we are testing just about anybody that walks in the office. So you're going to end up with lots of positives that really aren't sick patients. If you go to Italy, where they didn't test hardly anybody, really, they're assuming they died of COVID, but they're not listing the comorbid causes of death. This is a statistical nightmare. So understand how statistics work, and we're going to get on in a second as to how you establish the diagnosis to begin with. This is Dr. David Klein with Stages of Life Medical Institute. Stay tuned to the next installment.